Hi, I'm Dr. Lou Cabucci, and welcome to HealthView. So what's HealthView, you might be asking? Well, I guess the best way to describe it is it's a series of short video visits where I'll be discussing health and nutrition issues a lot of us encounter in our daily and, let's face it, pretty hectic lives. That's my area of expertise, and since 1995, I've worked closely with Schiff Nutrition to develop products and practices that people like you and I can really use to benefit our busy days and nights. So today, we'll be looking at some easy ways you can change things up a little. And I know you'll feel better if you try some of them. Okay, let's get started. May is Joint Health Month, and this month I'm going to update and review some news on our flagship product, Move Free Advanced, and also give an update on some exciting new news on glucosamine itself. Move Free Advanced has been around for years now, helping thousands of people to feel better and move better. It has had 2 human clinical studies. One thing I wanted to update everyone on this month that's new is that now we know better how the herbal component that we call Uniflex actually works to help improve joint health. There's some new technology that relies on what is called gene expression, and it measures what the cells are actually doing. In other words, what genes are they expressing and are getting turned into proteins, which means exactly what these cells are doing. And very interestingly, when you put Uniflex in with cells, immune system cells in particular, they do some really good things for your joints. And it's not just one gene here, one gene there. It's whole families of genes that control whole aspects of joint health, such as how your joint cells respond to noxious agents, how your joint cells respond to antioxidants, and how your joint cells respond to actually telling themselves to help repair. And as you guessed, that's exactly what has been found in these new studies of gene expression, that the right genes are turned on. The net result is that your joint cells are going to be a lot more favorable to feeling better, to actually doing what they're supposed to do, which is repair and maintain your joint tissues. And that leads to improved joint comfort and improved mobility and freedom of movement, and most importantly, it keeps your joint tissues, especially cartilage, healthy. And that means you feel better and stay better longer. So that is some exciting new news on Move Free Advanced and the Uniflex portion. Now we have 3 types of Move Free Advanced. I call them the red box, the blue box, and the green box. I think it's easier that way. Most people do just fine on what we call the red box, which is the original formula. That's also the formula that's been clinically tested and shown to help improve joint comfort in under 7 days, and also be a couple of times better than glucosamine and chondroitin alone after a good 8 weeks worth of using it. So that means that the red box works well for most people. Now, some people need just a little more extra added attention for their joints, and especially people that are worried about their bone mass, are worried about their cardiovascular system health. There's the blue box. The blue box has some additional MSM, which stands for methyl sulfonyl-methane, which is now you know why we call it MSM. Much easier to deal with. And that's a nice sulfur source so your bodies can help make more chondroitin sulfate in joints, which helps rebuild. We also add vitamin D3, which has been making a lot of news today for a lot of health reasons and a lot of health actions. But believe it or not, vitamin D is good for your joints. And human studies show that long-term good intakes of vitamin D actually help improve joint health over the long run. So the blue box is for the people that want more protection for their joints long-term, and also we know that, of course, that vitamin D is very good for your bones. So if you're having issues with your bone health and want to upgrade your bone health as well as your joint health, then the blue box is better. Now, for those people who just maybe aren't eating enough protein, they're just not getting enough food in general perhaps, or that they have just a little more joint discomfort, then we pull out the big artillery, which is the green box. Now, the green box has the same formula as the red box, but it has the full clinically tested dose of MSM, which is 1,500 milligrams. That amount of MSM alone is as effective as the 1,500 milligrams of glucosamine alone, and when it's combined with that much glucosamine, it's even more effective than either alone. And on top of that, there's Uniflex in there, which now we know does very good things to convince your joint tissue cells to straighten up, fly right, and help improve your joint comfort and improve your mobility. So for people that want the ultimate, if you will, in joint health, then we have the green box. Now the trade-off is that you have 3 pills a day, and they're slightly larger because that 1,500 milligrams of MSM has to go somewhere. So there you have it. Now you know the update on the good news about Uniflex that's in Move Free Advanced products. And now you know better on which product is right for you. Now a word about glucosamine. Glucosamine is the backbone of just about every joint healthcare product that's successful in the marketplace, and for good reason. Glucosamine is the most studied nutrient in joint health. There are many human clinical studies of glucosamine and how it improves joint comfort over time. The NIH, National Institutes of Health, sponsored the very large GATE study, glucosamine and chondroitin and arthritis intervention trial, and they measured things like joint comfort and function in their preliminary, or their first report rather, which was published in 2006. What they were also doing is taking x-rays of a smaller subset of people in that study to see what their cartilage looked like over actually a 1-year period. And we'll get to that time period in a moment. But they finally published that data recently. And the results of the researchers were not as encouraging as I had hoped to see, but I think they missed the point. And here's why. The group that took glucosamine hydrochloride, the same form that is used in Schiff Glucosamine products, actually had the least amount of loss of cartilage. In fact, there was no loss in cartilage over a 1-year period. Now, the placebo group lost a little bit of cartilage, although it wasn't statistically significantly different from the glucosamine group. We have what's called a p-value, probability value, and the probability that they were actually different was 6%, and everybody's looking for a 5% chance to be significant. Now, you give me those kind of odds in Vegas that you're right 94% of the time, I'll take them. Now, another point about that study is that it only went 1 year. Studies in Europe have gone 1, 2, and 3 years, and now 5 and 8 years for a follow-up of another study. And guess what? They started seeing the benefits for cartilage maintenance, the structure of it, after 1 year. So in other words, the GATE 2 study kind of just missed the boat, which explains why they almost got statistical significance. If they had gone a few months longer or another year longer, would have been very good looking for glucosamine, and I think a lot more people would be taking it. So that's the update on glucosamine itself. Keep taking it. Now, another feature of Schiff Glucosamine products is that it is what I call the value product for joint health, because we don't add extra ingredients like Uniflex or MSM or HA, which is joint fluid, or even chondroitin sulfate. It's just glucosamine by itself. It is a lower priced product. It has value. Sure, it takes a little longer to work. It may not work as much, but again, it is backed up by dozens of human clinicals and tens of millions of human days worth of use over the last 30 years. It's an excellent value, and in this day and times, that's a wonderful thing to have for your joints. Well, that wraps up this segment, but hopefully it's just the beginning for you, because when you try out some of these tips, I think it'll be the start of a healthy and strong approach to living. And what's great is none of us have to do this alone. For more information about any of the products I've talked about today, simply use the product search toolbar at the top of this page, because, hey, we can all use a little help. Till next time, I'm Dr. Luke with HealthView. Here's to your health.